Breakthrough infections, they don't happen often, and it's still not clear who is at highest risk of getting one. Jacki Zender recently spent a couple of weeks in her basement, isolating from her family. She's double vaccinated, super careful, and she still got COVID.
And I thought, really, why? Why is this happening? I'm not partying, I'm not doing things that are putting me at risk. And I was just frustrated and upset and then terrified.
It may seem baffling, but it's not unexpected. About 30% of new COVID cases in Ontario are among fully vaccinated individuals. And while the vast majority of cases are mild, they can feel rough.
Like I had been run over by a truck, like I could not function.
Zender was being monitored daily by a virtual care team at Toronto's Michael Garron Hospital. Dr. Jeff Powis is the medical director of infection prevention and control there.
The vaccine is like one of the most amazing medical things that's come in my career. So we get a bit of
breakthrough infections happen, he says, because while vaccines offer excellent protection, they're not perfect.
I think people thought it was this flak jacket they were putting on to go back out and do everything they love to do again. And I think what Delta has taught us is that the vaccine is your seatbelt. You need to do everything else appropriately ahead of time. Continue to obey all the public health advice, because those things are the principles of staying safe.
Zender is a physical therapist. She was vaccinated before most people. Waning immunity may be a factor. She doesn't know how she got infected, and no one in her family got sick. They're also vaccinated. How breakthrough infections affect close contacts is something Powis is studying, but it's already clear vaccines are protecting most of us, he says.
I think we aren't realizing the number of times that there may have been a transient exposure at the grocery store or some other location, and the vaccine was able to prevent us from getting sick. That makes me think there probably are exposures we're having as vaccinated individuals that we don't ever recognize because we don't end up getting sick.
Experts say the number of breakthrough infections will continue to rise because the highly contagious Delta variant is still circulating. But the highest risk of infection and severe disease remains in the smallest denominator, the unvaccinated. According to Ontario's estimated weekly case average, 367 COVID infections are among the 4.1 million who are partially vaccinated or unvaccinated, compared to 172 breakthrough infections among the 10.6 million who've had both shots. Dr. Callie Barrett is a critical care doctor at Toronto's University Health Network. She says breakthrough infections are small in number, but can still cause severe disease in more vulnerable populations.
I'm fully vaccinated. I could still become infected, have a breakthrough infection, and become infectious and potentially get my kids sick. And my kids then could go to school and potentially pass it on in their classroom. And those kids could take it home and infect their grandparents.
Barrett says vaccines offer the best protection for everyone.
The message is, if you haven't been vaccinated, or if there's people in your family who are eligible to get vaccinated, please, 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 please get vaccinated, because you're doing it for yourself. You're doing it for those in your family. It's so devastating what this is doing to families.
My sense of smell, taste, and I think my hearing is still reduced.
As for Zender, a month after testing positive, she still battles symptoms, including fatigue. But she's grateful.
I still feel thankful that I made it through, and even if this is as good as it gets, I still feel lucky. And I knew that it could have been much worse without the vaccine.
A reminder that in such a small number of breakthrough cases, there's a much bigger cautionary tale. Joanna Rumiliotis, CBC News, Toronto.